Good morning, everyone. My name is Akhilesh Kumar. I am working as an assistant professor in the Faculty of Pharmaceutical Sciences, Rama University, Kanpur. Today, I am here to present my lecture on topic pharmaceutical dosage form and their classifications. So, the pharmaceutical dosage form is the first topic of pharmaceutic subject, which is the comes in B form, D form, and uh, D form, and Form D syllabus. So this is the topic one, unit one in the department of Form D. Okay. So what is pharmaceutical dosage form? Let's get started. What is pharmaceutical dosage form? A dosage form is a physical form of medicines of a drug is manufactured and administered to patient. It is the vehicle that carries the medicine into the body to the patient. Okay, the what is the medicine, and what is the exactly medicine is made from? Medicine is made from two things. A drug or a dosage form is made by two things. First one is API, which is active pharmaceutical ingredients. Active pharmaceutical ingredients, and API and excipients. API is stand for active pharmaceutical ingredient, which is the main component of any dosage form. That is the drug. Okay, the drug is the main component which provide the pharmacological effect. And excipients. Excipients are the bulking agents, the coloring agents. The excipients are the components which are used to help in the formulation of dosage form. Okay, then the dosage form combines active pharmaceutical ingredients, excipient for safe and effective delivery. Dose precisions, basically the dosage form is made for the accurate doses. Okay, for made ensure to accurate quantity of drug reaches to the patient every time. Okay, so the patients can help to take a accurate dosage form without any expert's hand, and delivers form in like tablets, capsule, syrup, ointment, inhalers, and many more. Okay, so these are the pharmaceutical dosage form. Okay, why are dosage form is important? The first question is, why are dosage form is important? Because the dosage forms provide accurate dosing and drug stability. When the drug enter into the body in a desired form, then it provide a drug stability and taste masking. Of course, some API have better in taste, so that the some tasting or flavoring agent, like some sweetening agents, to mask the bitter pleasant of the drug. And controlled release, sometimes the drug have a therapeutic effect which needs for prolonged effect, like some NSAIDs, non-steroidal anti-inflammatory drugs, have prolonged effect because the patients need to relieve in pain for long time. Okay, then patient complains like improve adherence and overall therapeutic outcomes. So these, that's why the dosage form is important. Okay, so first when we discuss about the what is dosage form. Dosage form is the API and excipients is a physical form of drug which we take, the patient take into the body for the treatment of diseases. Okay, then next we'll discuss about classification of dosage form. So the classification of dosage form, the pharmaceutical dosage forms are classified into two types. First is on the basis of their physical form. That means the form of the drug, that the physical form of the drug, it may be liquid, it may be solid, it may be semi-solid, it may be gaseous. Then another classification is based on the route of administration. Okay, the classification based on the route of administration. So the route of administration is classified into different types, like the drug which enter into the body by the different routes. First one is oral. There are number of pharmaceutical dosage forms take through oral, like tablets are taken by orally, capsules, syrup, suspension, and the oral dosage form is safe medicines taken delivery system. Then parenteral is for injection, like intravenous, intramuscular, subcutaneous. The parenteral dosage form is used for rapid response. The patient which are unconscious, the patients which are unconscious, so they take through IV or through IM. Then the topical, some dosage forms are comes in the under the classification of topicals, like cream which is applied on the skin surface, ointment which is also applied on the external layer of the skin, lotion which is applied directly to the skin. So the skin is the organs which absorb the drug API through topical. Next is inhalation, aerosols, nebulizers, the drug which is inhaled through inhaled in a gaseous form, like aerosols, nebulizer, inhalers. These are delivered drug to the respiratory tract. Okay, so this is the another dosage form which is comes under the classification of route of administration. Next is ophthalmic, otic and nasal drug delivery system, which is like, what are the examples for the ophthalmic drug delivery system? Like eye drops, ear drops, nasal spray for local or systematic effect. Then next, last one is rectal and vaginal. Some suppositories are taken by rectal. So these are all the comes under the route of administration. Then second classification is classified on the basis of their physical form, that is solid. Okay, some drugs are formed in solid, like tablets. Tablet is solid dosage form. Capsules are also solid dosage form. Powders, granules. Then these are the most stable, because solid dosage form cannot easily react with each other. Okay. Then liquid dosage form, solutions are made by two or more than two, these are the biphasic liquid dosage form, suspensions, emulsion. Basically solutions are suspension and emulsions. Syrups are monophasic liquid dosage form, which contain one phase, that is water phase. Okay. Then suspensions are made comes under the classification of biphasic liquid dosage form, which contain two or more than two phase, like oil phase, oil and water, oil in water, water in oil. These are the emulsions. Syrup is a monophasic liquid dosage form. Then next one is semi-solid. Semi-solid is cream which is in the physical form of semi-solid. Ointments, gel, paste. Okay, so these are comes under the semi-solid. Next one is gaseous dosage form, which is inhaler, which is aerosols, these are the some medicinal gases are comes under the gaseous dosage form. Okay, so these are all the, here are some graph of the pharmaceutical dosage form. This is classified into two types: classified on the basis of physical form, classification on the basis of route of administration, liquid, solid and solid dosage form, liquid dosage form and semi-solid dosage form. Basically, liquid dosage form is classified again two types: monophasic and biphasic solids and gaseous. Okay, so these are the classifications of solid dosage form. Next, what is solid dosage form? There are some examples of solid dosage form. Tablet, which is compressed powders. Tablet is basically manufactured by three methods. First one is, the tablet is manufactured by three different method. First one is direct compression. Second one is double compression or dry granulation. Dry granulation. And third one is wet granulation. Wet granulation. So tablets, compressed powders may be sugar coated, film coated or enteric coated for the taste masking and protections. Capsules, hard or soft gelatin cells enclosing powders. Okay, so capsules have two, one is body, and capsules have two parts. One is body, another is cap. Okay, so body covers powder or drug powder and API, which is the mixing of API and excipients, cover with the cap. Then lozenges, which is used for the relief in cough. Then effervescent tablets. These are the examples of solid dosage form. Then next one is liquid dosage form. There are some examples of liquid dosage form. Solutions basically clearly homogeneous or heterogeneous mixture with, and suspensions. Final solid particles dispersed in liquid require shaking before use for uniform dosing because they contain two phases of the. Then emulsions. Emulsion is oil in water or water in oil mixtures stabilized by emulsifying agent. Then elixirs. These are the examples of liquid dosage form. Next one is semi-solid dosage form. What is semi-solid dosage form? Semi-solids, that is cream, which is water in oil emulsion type cream, and ointment is also a semi-solid dosage form. Gels and paste, these are all the semi-solid dosage form. Then next one is gaseous dosage form. Gaseous dosage form, which we take through the respiratory tract. First one is inhalers and nebulizers deliver aerosol drug directly lungs for asthma patients for the treatment of respiratory disease. Next one is transdermal patches. Then transdermal patches also are gases like. Then emergency system, these are the nanoparticles, liposomes. Okay, so these are the gaseous dosage form. Okay, so these are all the classification of pharmaceutical dosage form. There is summary, which is dosage form, classification, formulation, and patient factor. So there are some dosage form which we provide the accurate drug, accurate API, accurate active pharmaceutical ingredient to the patient for the better treatment. Hope you like. Thank you.